Look, I would like to introduce Dr. Lucile Cornet-Vernet. She's not a physician, she's a dentist, but she was interested in infectious disease by a personal problem in her family, but she discovered the efficacy of Artemisia on malaria by chance because one of her friends was nearly dying in Africa and was saved by a herbal tea. And as she's very dynamic, she organized a fantastic job in different countries in Africa to prove the efficacy of the plant. And it's not about Borrelia, but I thought it was interesting to hear Lucile to understand how she could have money and organization to do this beautiful job. And thank you, Lucile.
I want to thank Christian for inviting me to speak to you about Artemisia plants. The story actually began with malaria, the disease that impacts half of the global population, causes 435,000 deaths last year, with a stagnation since 2015. Unfortunately, resistance to insecticides and medicines are more and more widespread. It costs around billions to African economy each year. The current solutions are medicines like ACT and bed nets, but the problem is that in Africa, at least 23% of medicines in circulation are counterfeit. Another additional solution could be Artemisia plants. Artemisia annua and Artemisia afra are from the Asteraceae family. They are commonly named wormwood and African wormwood. They have been used for centuries in China and in Africa as antihelminthics and antimalarials. Infusions and oral consumptions of the dried leaves and stems of the plant have prophylactic and therapeutic efficacy. You can find in them hundreds of active compounds, including phytosterols, flavonoids, essential oils, terpenes, like artemisinin in Artemisia annua only, polysaccharides. There is no toxicity and no side effects noted to date. The use of the medicinal plant along history is normally considered to be an evidence for their efficacy and non-toxicity. They are GRAS in USA, generally recognized as safe. And no development of resistance has been noticed in centuries for use in China and South and East Africa. We wonder why such a simple and cheap solution has been not spread out earlier. The point is, who will finance research and diffusion for a therapeutic solution that does not make money? An NGO. The whole story began in Ethiopia with the spectacular recovery of my friend Alexandre Poussin from malaria falciparum with Artemisia annua herbal tea. It occurred in a little dispensary where there was not antimalarial medicines anymore. Fortunately, the American sister who was in charge was a medical doctor and cultivated Artemisia annua plants in the backyard. Alexandre drank liters of infusion and was cured in 24 hours. La Maison de l'Artemisia Association was founded with Alexandre and other friends in 2012 to work on Artemisia plants, an effective, accessible, and local solution available to affected populations. Our mission is to demonstrate the clinical effectiveness of Artemisia annua and Afra herbal teas with international standards. 2, to set up specialist centers, bringing together medical and agronomic skills according to a charter of best practices, les Maisons de l'Artemisia. In order to realize our mission, we had to find a lot of money, as trials are very expensive. So we set up a fundraising system. We have support from great foundations and corporate sponsorship. We also have philanthropic donations by our own foundation under the aegis of the Caritas Foundation. Foundation Terra Artemisia allows donations of real estate wealth tax, IFI. Hundreds of individual donors are also interested in this cause. They see the well-funded of this project and how our research system is blocked by patents and obligation of making money. La Maison de l'Artemisia NGO is an officially recognized charitable organization. In France, the tax authorities encourage donations by individuals or companies by enabling them to claim a tax deduction on donations to charitable organizations and foundations. According to the French tax law, individual donors can enjoy a tax reduction of 66% of the amount of they donate, up to a maximum of 20% of their taxable income. So, in 2015, we funded 2 randomized, double-blind, large clinical trials in DCR, Congo. The first one was effect of Artemisia annua and Artemisia afra T infusions versus praziquantel on schistosomiasis in 800 patients. The second one was Artemisia annua and Artemisia afra T infusions versus artesunate amodiaquine, AZAC, in treating Plasmodium falciparum malaria on 957 patients. Both were made by an international team from DCR, France, Luxembourg, Belgium, and USA. The schistosomiasis trial was published in Phytomedicine last year. The study design is 3 arms, praziquantel, annua infusion, afra infusion. It's a superiority trial. 800 patients were randomly assigned to one of the 3 arms. There was written consent to participate in the trial. Parents signed for minor patients. Sample size was statistically determined. The criteria for inclusion were schistosomiasis monsoon positive stool examination, no medication for treatment of schistosomiasis. Medical treatment was maintained for patients already receiving treatment for another known disease, and were excluded children under the age of 6, elderly patients, pregnant women, patients with concomitant acute or severe chronic disease, patients with the hepatosplenic form of the disease. We can notice in the phytochemical analysis of plant material how many compounds there are, and artemisinin is only present in Artemisia annua and has traces in Artemisia afra, known here. For the drug administration, in the Artemisia treatment arms, patients drank 1 liter of Artemisia annua and Artemisia afra infusion daily for 7 days. Infusion was prepared with 5 grams of dried leaves and twigs of Artemisia annua or afra, added to 1 liter of boiling water, infused for 10 minutes and filtered. To double-blind this trial, they received praziquantel placebo from D0 to 7. And for the praziquantel group, patients were treated by praziquantel tablets, 40 milligrams per kilo 1 day, followed by praziquantel placebo for 6 days in order to follow the 7 days treatment schedule for the Artemisias. They also received Artemisia placebo. Tea was prepared with 0.2 gram per liter of plant material from D0 to 7. It's the WHO guidelines for traditional medicines. Eggs disappeared faster in fecal samples and within 14 days for both Artemisia annua and Afra treated patients compared to those treated with praziquantel. There was no significant differences between Artemisia's species from D3 through D28. And there's significant difference in egg count between Artemisia species and praziquantel from D3 through D21. Adverse effects. In praziquantel treated patients, we had vomiting, abdominal pain, headache. They were the most common adverse events observed. In the 2 Artemisia arms, no patients suffered any of those and other undesirable effects. In conclusion, the trial showed that both Artemisia and annua tea infusions were at least 30% faster acting against bilharzia than praziquantel, but with equal efficacy at D28 for both genders. There also were fewer adverse effects on patients treated with the Artemisia tea infusion than with praziquantel. The second trial, Artemisia annua and Artemisia afra tea infusion versus AZAC in treating Plasmodium falciparum malaria in a large scale, double-blind, randomized clinical trial published this January in Phytomedicine. In the background, DCR has one of the highest malaria rates. In 2016, more than 50,000 people died, mainly children. Maniema province is a hollow endemic zone with more than 80% of the population infected by falciparum. In 2005, artemisinin combination therapy became the first-line treatment for all in DCR. But medicinal plants represent the main, if not the only treatment accessible to much of the people of the humanity. For traditional medicine, WHO provided guidelines and encouraged studies in clinical trials on herbal medicines. Artemisia annua and Artemisia afra, of Chinese and South African origin, respectively, were used for centuries medicinally as infusions or powders to treat malaria. Both showed in vitro efficacy against Plasmodium falciparum. A large-scale clinical trial aimed to confirming encouraging results from smaller-scale trials in Africa and South Africa with annua or afra. In those small trials, cure rates of more than 95% were reported. Plant material handling and phytochemical analysis are the same as Schistosomiasis trial. Annua had around 1.5 milligram artemisinin per gram dried weight. Afra had almost no artemisinin. Study design is in 3 arms: AZAC, annua, afra infusion. It's a superiority trial. 957 patients were randomly assigned to one of the 3 arms. There was also written consent to participate in the trial. Parents signed for minor patient. Sample size was statistically determined. Drugs were distributed in numbered, opaque envelopes selected randomly by each patient. Criteria of inclusion were adults or children over the age of 5 with axillary temperature more than 37.5 Celsius and parasitemia of 2,000 to 200,000 trophozoites by microliter. Medical treatment that did not violate trial exclusion criteria was maintained for patients having a known disease other than malaria at the beginning of the trial. Clinical and laboratory analyzed. Thick and thin blood smears were microscopically analyzed for trophozoites and gametocytes, respectively. Trophozoites were measured by microliter of blood. Gametocytes were noted as present or absent to determine number of carriers. Slides were scrutinized by 2 independent laboratories. Patient follow-up, including thick and thin blood smears, was at D1, 2, 3, 4, 7, 14, 21, and 28 post-trial enrollment. From D0 to 7, patients were treated in hospital to ensure therapeutic compliance. Hemoglobin, ALAT, and AZAT also were measured. For drug administration, AZAC was administered as tablets once daily for 3 days, followed by AZAC placebo tablets for the remaining 4 days. In the Artemisia arm, same as the schistosomiasis trial, pediatrics and adults received the same amount of Artemisia T infusion. There was no adjustment for body weight. It was too complicated method. This is how we did. So everybody had something to drink and something to eat every day. It was easier like that. According to this graph, both Artemisia species cured malaria more effectively than AZAC. You can see here. This is here for Afra, here for Annua, sorry, and this is for AZAC. And for AZAC, there was remain here. There were 344 patients with parasites at D28, 9 for Annua, 25 for Afra, and 310 for AZAC. Due to the degradation, it's very important that due to degradation of stored blood samples, we were unable to conduct a valid PCR analysis for the D28 patients with parasitemia as recommended by international standards. We tried 2 times. It was not, completely not good. Considering the large number of D28 patients with parasitemia and thorough PCR analysis is needed in future studies. So cure rates were established by D28 parasitemia. For AZAC, it was 34.3%, for Afra, 88.8%, and for Annua, 96.4%. Fever progression. Both Artemisia species cure malaria faster than AZAC. For gametocytes carriage. In AZAC treatment patients, 10 of the 472 patients were detectable carriers. In Artemisia treated patients, no gametocyte carriers. That means no more transmission of malaria. For the side effects, we had almost 5% in Artemisia arms and 42.8% in the AZAC arms. For the biological tolerance, ALAT and AZAT were not altered, but for the hemoglobin level, the similarity between AZAC and Artemisia annua is likely the result of artemisinin, known to reduce hemoglobin during treatment. Artemisia afra, here, has no artemisinin, so that's why it's like that. Synergistic effects. Artemisia annua and afra contain hundreds of phytochemical molecules and minerals. Antimalarial activity has been demonstrated for some, 20 of these, as summarized in the review by Weathers and al. Artemisia afra has only trace amounts of artemisinin and no detectable artemisinic parent molecules. Patients treated by afra had almost the same therapeutic response as those treated by Artemisia annua. Artemisinin drug resistance. Low artemisinin content for the plant elicited concerns that this might induce artemisinin drug resistance. Studies showed that the numerous phytochemicals in Artemisia annua and Artemisia afra provide synergies and multiple interactions, likely constituting a polytherapy against malaria. Together, those data and this study indicate that artemisinin is not the sole phytochemical demonstrating antimalarial efficacy by Artemisia species. So in conclusion, Artemisia plants can be grown and used by local populations, which could help counteract the problems that caused by fake or obsolete antimalarial drugs. Further, large-scale studies be launched to optimize use of these plants and posology for infants, pregnant women, and others, in the case of uncomplicated as well as severe malaria. Merci beaucoup.